really take advantage of the time they've given us, and we will do a good process this year. So speaking of year, we're very happy to have Patty join us again to focus really on what's coming next in terms of FY23 and then a look at Hillcrest. I do want to remind you that the Q&A is open, and if you have any questions, just hit the Q&A box at the bottom of the screen, type them up, and we will make sure we get them answered at the end of the session. So with that, Patty.
Great, thanks, Brendan. And just on that last note about performance evaluation, and it kind of goes back to our point about, our culture is our bedrock, and that we really want to be the place where people want to work in San Diego, right? We want to be the employer of choice in San Diego. That's a goal of ours. And there's nothing more powerful than the opportunity to sit down with your manager and to have a conversation about your performance and about where you are. And I really encourage everyone. The mind performance is the infrastructure behind that. Nothing is more important than that conversation you have with your direct reports. You really set the culture. You all really set the framework for this organization. It's at your level, even more so than mine, that kind of conversation and that kind of culture gets built. So as we thought about building the house and we thought about, each of these key elements, I just want to highlight them, one more time. I know you've seen this before, but, we really want to address staff and physician trust and leadership. We really want to be in the top 25. We're not there right now. For a lot of reasons, we're not there. And we have a lot of work to do in engagement to improve both for staff and for our physicians. And we've got a lot of work rolling out. But we really, really want to begin to address this long-standing, in fact, kind of exacerbated by the pandemic, this angst in the organization about trust and alignment, and that we're a great place to work. We really want to be that for our team members. So lots of focus there. We really want people to recommend us as a place to work and a place to receive care. Super important. And we want people to be educated on follow the integrity standards. This is something that will come out through the compliance training. And you can look at it like it's a compliance thing, or you can look at it as a value thing. This is super important to us that we walk and talk with integrity. And we really want to be recognized as a Fortune's best workplaces for diversity. We've had the privilege of bringing on a new CAO. I know you've had a chance to meet her. Dr. Crystal Sene, she's on board and learning quickly about our organization, and will be taking the framework, the anti-racism framework that you've seen in other formats, and continue to build it out, working to complete the audit, looking at the recruitment and retention policies that we have, our healthcare policies, our health disparities work, and to figure out how to organize it and help us really step forward. So on that, we build on our financial foundation. And as you know, our goal has been to reach and maintain 80 days cash on hand. Our cash had dipped when we opened up JMC and KOP, and with the cash demands on our cash for the school and for other reasons. This is actually going to change. This metric is actually going to change to 90 days. And so that's going to put a stress on us. We won't have to get there next year. We won't have to get to 90 days, but we'll have to be on a trajectory to get there in the next several years. And it'll be challenging because we're using cash to stand up our new outpatient pavilion in Hillcrest and to support a lot of other things. But we'll need to build that cash to 90 days. And the good thing about it is that it'll put us in a position with our other UCs to go to the bond market and to raise the cash and the capital we need to do the Hillcrest Replacement Hospital. So as we sit today, we have to go to the debt market at some point to get the dollars that we need. So we need this metric to be at that 90-day mark. But again, we have a couple of years to get there. That doesn't have to happen overnight. From there, we build our clinical delivery pillars, delivering excellent experiences. And you saw the current situation now where we are at max in terms of our delivering excellent experiences, but we have opportunities for improvement. This morning at Tier 5 alignment, Leslie Wilson went through where we were falling short on our experiences, and the area we focused on was on wait times. And not just wait times, which we're trying to address, but what happens to a patient when they're waiting? What happens to a family when they're waiting? What's that setting like? And out of that conversation this morning, I just encourage all of you to take a look around your environment and make sure that your environment is really warm and accepting of our patients. No self-made signs, just put an eye on how a patient would look at things. We saw pictures of torn chairs. Let's own your environment and make sure that your environment is just as supportive as possible to our families and patients as they wait for care. We want to achieve high reliability. We've talked about the Vizient metric a lot. Margarita just highlighted this. We're in a really good position right now after the end of Q1 to stay in the top 5, but we're going to have to do a lot of work to stay there, because I don't know if you noticed in Margarita's numbers, UCLA is trying to pass us, and they're making progress, as is UCSF. And we really want to be in the top 3. Be great if we were number 1, but at least let's see what it would take to be in the top 3. We've also just made a decision to put some investments in the idea of clinical efficiency, meaning a team that could help us develop clinical protocols, standards of care that we can standardize through the health system, and to both manage costs, but more important, manage the variation of the delivery of healthcare that we are doing. And then finally, that we're providing an accessible, comprehensive care network. And we spend a lot of time building out our network, our clinical integration network, our Medicare ACO, working with the payers on payer products, trying to position ourselves to actually take care of our own employees. So lots of work in that area so that we can, again, be really relevant in this market, and not just relevant, but to be, I won't use the word dominant because it's probably a little strong word, but we really want to be, the preeminent healthcare system in San Diego. And finally, then to, sustain our US News and World Report rankings. Number 1 in San Diego, top 5 in California. I'd love to see us move up in California if we can. So that voting actually is going on as we speak, and we'll get that results later in the winter, early spring. So that's our overall framework. That's how we think about all the work that we need to get done. It's a lot, understand that. So we try to boil it down a little bit. So next slide. So we have a planning cycle where we evaluate, our progress from last year. So in the summer we did and this is the executive team and others, we did a review of kind of where we sat with respect to all of those goals I just outlined, and where we needed to make investments and improvements, and where we needed to really emphasize our time and attention. In the fall, we refined the long-term goals. Now we're in this winter season where we are really honing in on what we think the 12-month goals for FY23 will be, and then we'll start cascading them to all of you this spring. We've got a meeting coming up in March where we'll kind of I'll give you a little snippet of what we think it's going to look like, but then we'll finalize them and roll them out in the spring to you. Next slide. So the buckets of priorities for FY23, and again, the executive team hasn't had a chance to thoroughly vet this and go through this. We will in an upcoming meeting, but the areas of focus for the whole organization really is around patient access. As Brendan said, for a lot of reasons, UC San Diego Health is in very high demand in our region. And you can see it in the ED numbers. You can see it in the number of patients in beds. You can see it in our everyday, challenge with respect to bed flow. You can see it in the patient access numbers. As much as we're growing, and we're growing like crazy, we can't keep up with the demand of services that people want from UC San Diego Health. It's a great problem to have, but we need to create, that capacity to take care of more and more patients. So that's going to be a huge point of focus. Secondly, site of care, that we are in this process of shifting from value-based care to volume-based care to value-based care in a lot of our services. So over 50% of our primary care is actually already in a value-based environment. We're going to be doing work in oncology for oncology medical home, which is a value-based approach to oncology care versus a fee-for-service, volume-based, bill more and get paid more kind of models. So there's going to be a lot of shift on that under the direction of Duncan Campbell and Dr. Parag Agnihotre. We've made huge strides in helping build infrastructure to care for our population health patients, and we'll continue to accelerate that work. We're doing a lot of work with the School of Medicine and the Vice Chancellor's Office around strategic alignment. This is the fund, we call it funds flow. This is the cash that leaves our health system that goes into supporting the clinical departments in the School of Medicine and others to support other work going on, the education mission, the research mission, et cetera, and also to help support paying our physicians at market rates. And so we're making some tweaks on that. We're trying to do some realignment because what we learned from our faculty was that they felt that there was a disconnect between really the tri-missions, that our movement to an RVU-based model was done at the expense of the education mission. Even though we know that wasn't true, it felt that way to the faculty. So just trying to figure out how do we move the dollars around differently, how do we simplify it and make it more transparent. So this is actually a huge change effort for senior leadership with our department chairs and our faculty leaders. As I mentioned before, we've got a lot of work to do now that we've got Crystal on the ground around equity, diversity, inclusion. Super excited about this work. I know Margarita's already talked about the diversity training, which as online training goes, those are the best modules that you can do. And they're actually quite good. We're bringing next week, we have the opportunity on campus. We have Isabel Wilkerson will be here speaking with some limited audience, but she wrote the book Cast, which I'm reading right now, and I highly recommend it to all of you to get it on audiobook or to read it. It really helps reset and reframe this conversation about structural racism and what we're going to need to do about it. You know, the other point I'd make about this is that the pandemic opened a chasm of understanding between haves and have-nots and health disparities in care. And it really woke us up, and we did a lot of things to try to address that by, for instance, building up the mobile van vaccine clinic to go out to the communities and deliver vaccines. And we have that infrastructure now. So where do we go with that? How do we start improving the health of our community by going out to our community partners and providing access to some of our world-class physicians and staff? Our biggest pain point right now is in inpatient capacity. And I told this story this morning at the MedStaff Exec Committee where, you know, on the one hand, I have my emergency department leadership saying, you know, I've got 50 patients that need inpatient beds and they're waiting in halls and we need to get them in beds. And I've got my peri-op leadership saying we're constraining surgeries because we need more beds and we need to pick up. We've got transfers coming in for transplants and other services. We've got pressure points all around this concept of inpatient capacity. So how do we get more beds? So there's kind of two parts to this question. I think in the short term, it's how do we drive more capacity out of the existing beds that we have? And that work will be enhanced through our readmission work, our hospital flow work under the CMO's office, and through the care management team. And how do we get patients home quicker? What services did we provide them at home so they don't have to come back to the hospital? How do we have what, you know, how do we take what we already have and try to drive more through it? And then the bigger question is, how do we get more beds, right? So strategically, there's a lot of conversation about what that means to potentially, quote, get more beds. And we've got a number of strategies we're working on there. And then the point I made before, which was engagement. And the last point I'll make about engagement, I've already talked about it, is that we know how tired the teams are. We're tired too, right? We know how hard this whole period of time has been. And we need to find ways to acknowledge and engage our staff and meet them where they are. And if they have specific needs, whether they're mental health needs or other needs, we need to try to support them through that. And so the engagement committees are really working hard at trying to figure out how best to support our staff. If you have a lot of interest in that, we'd love your ideas, we'd love your engagement, because we're going to need every single person on this phone to be involved in engagement to really address the engagement challenges of our team members. Next slide. So as you know, those goals all tier down through our tiered structure. So for instance, in creating a culture of integrity and engagement, tiers down to a tier 5 goal about developing a feedback system for clinical faculty and staff. That has a lot to do with the systems that we're going to roll out to collect data, and also some of the work that we're going to do to improve engagement. Dismantling structural racism will roll down to tier 5 in terms of increasing awareness and implicit bias amongst directors. And then that actually rolls into our people goal for those of you on SEMREP, the SEMREP incentive that we're really addressing and increasing the awareness of implicit bias amongst this group on this phone call right now. The financial sustainability rolls into our efficiency goals, and I won't read this whole slide, but you know the connection. So, by setting up this kind of cadence and this kind of structure, we make our goals real at the tier 5 level and at the rest of the tiers, and we connect the dots to our staff. The employee-wide incentive is going to be around Net Promoter Score, and as Margarita said, we're sitting at maximum right now. We were able this year to expand our incentive awards to include MPs. They were never included before, and residents and student health. So trying to reach out further and making sure that everybody is aligned around improving our Net Promoter Score, but also that everyone has an opportunity to receive this incentive. And then we've talked about Vizient a lot. So that's how it can cascades through the organization. So as we refine these goals going into FY23, we'll refine this deck and push it out and make it clear going forward. Next slide. Okay, so I'm going to switch gears altogether, and I'm going to just do a quick update on Hill